Hello, I'm Carol Gilling-Smith. I'm the Medical Director at the Agora Clinic. I just want to give you an update regarding COVID and how we're managing things at the clinic, given the high rates that we're experiencing in the community. When we first reopened after the first lockdown, we put in place a very strict policy. But in that policy, we didn't feel that the COVID rates in the community were sufficiently high for us to need to COVID test all our patients and staff on a regular basis. As we came out of the second lockdown in November, it became apparent that there was a new variant of COVID which was more transmissible and that COVID rates in the community were rising. And we can see from both our local figures in the southeast and national figures that the pandemic has taken a new dimension. For that reason, we sat down as a team and carefully thought through how we can continue to offer our patients safe treatment. Our top priority is to make sure that all our staff and all our patients remain safe, and of course we want to protect your gametes and your embryos. So we've made the difficult decision that in order to continue treatment, we need to be testing both our staff and our patients on a regular basis. So the changes came about at the beginning of this year, on the 1st of January, and all of our staff take a lateral flow test at the moment once a week. I'm pleased to report that on the first week we didn't detect any COVID in any of our staff. We've also asked our patients to have a COVID test 72 hours before their first stimulation scan appointment after starting treatment for IVF, for a frozen embryo transfer after taking medication, and also for patients undergoing intrauterine insemination. For patients who have single appointments, such as early pregnancy scans, we're again asking you to have a COVID test 72 hours before your appointment. Obviously, it's really important that patients who are undergoing treatment don't become ill with COVID or coming into the clinic have COVID which they could pass to other patients and staff. And it's for that reason we've made the difficult decision to ask all our patients to self-isolate for 10 days before they start treatment and for the duration of their treatment. We understand that's going to cause a problem for some of our frontline workers, people who cannot work from home for whatever reason. Our belief that this is the right thing to do, because if we start to see rising numbers of staff infected with COVID, we will be unable to continue our service. And so we want to protect the service and be able to treat as many patients as possible during this third lockdown. I'm hoping as the rates of COVID in the southeast fall, we will be able to relax those measures, but we can understand the stress that is causing patients. And we have done our best over the last week to answer as many questions as you ask us, really. We've had 3 or 4 members of staff on the phone at any one time or on Salve trying to answer questions. I have put on the website an updated COVID information guide showing the changes in our policy. And I'm also very keen that you feel free to call us to ask questions if you have any further questions. But do remember that if we are overburdened with questions, we won't be able to focus our staff efforts on looking after you as patients as you come through treatment. So do be mindful of that and read everything you can on the website first. Self-isolation isn't going to be possible for patients who are frontline workers. And those patients, I totally understand, will feel frustrated if they can't start treatment, and they're going to have to make a difficult decision about what they want to do. We will always support you and write to your employer if you feel you want to move ahead with treatment. But if you are a healthcare worker, you are likely to be prioritised for vaccination and be able to be protected fairly soon. As I move on to vaccination, that's the second key topic that patients are asking us about. Some people will be fortunate enough to be first in line for the vaccination due to their personal circumstances or to their work. And for all of those of you who are in that category, I urge you to take the vaccination. At the moment, the vaccination is being rolled out in 2 doses, and they are telling us that there may be up to 12 weeks before the first and second dose. That means that if you have the first dose of vaccination, there will be uncertainty as to when the second dose will be given. You will probably get some protection from the first dose within 2 or 3 weeks of having that dose, which will allow you to continue your frontline work and to come through and to have treatment with us, even if you're not self-isolating. However, because this vaccine has been rolled out very quickly, we don't have the long-term safety data of the safety of the vaccine in pregnancy, which we've always had with other vaccines, such as the flu vaccine. So it is difficult to know if it is 100% safe. In all probability, it will be safe, but if you are waiting for that second dose and you conceive, you will have to make the difficult decision as to whether to take the second dose or not. And we won't be able to make that decision for you. It may well be that by the time you conceive, we have more safety data, which is reassuring, and you can have that second dose. If you get COVID during the course of treatment, whether you're a man or a woman, it may delay your treatment because it can take some months to recover from COVID. What we know about viral diseases, such as severe flu, is that the man's sperm quality and quantity can decrease quite significantly, and it may also take time for a woman to recover. So it is potentially worth thinking about delaying treatment. Most of all, I want you to know that we are really trying to support each and every one of you, and all these decisions that we have made have not been taken lightly. What I hope most of all is that we will be able to get everybody through for the treatment they need in the safest possible way, and that very soon we won't need all these measures that we're putting in at the moment. We'll be able to relax the measures, we'll be able to let you come through for treatment without the need for COVID testing. Some of our patients have asked us about acupuncture and whether it is safe to continue with acupuncture during this third lockdown. I've been in touch with one of our local acupuncture specialists, and we've got reassurance from the British Acupuncture Society that you can continue with acupuncture provided it's being conducted in an environment which is protecting against COVID. So if your acupuncturist is a member of the British Acupuncture Society, they will be conforming to the guidelines, and they will have the same measures in place that we have, bar the COVID testing. So it is absolutely fine, even though you are self-isolating, to continue your acupuncture appointments and have those going hand in hand with your appointments at the Agora. I hope the information that I provided in this video has answered most of your questions, but I do want to stress we are here for you, and if you need to have any further questions answered, a member of my team will always be on hand to help you to try and find the right way for you to go through treatment safely. And I will just conclude by wishing everybody the very best of luck in 2021, and hope that we will be able to celebrate at the end of this year many, many successful outcomes.